Hi everybody, and welcome to our second anxiety video as part of the Healthy Minds series. Today we're going to be talking all about anxiety, looking into some of the specific anxiety disorders in some more detail, and looking at symptoms and some treatments as well. So again, this is what we are looking at here. So anxiety disorders, interesting to note too the gender differences here, which is quite interesting. Now, another reminder with this one, please remember that we are not qualified to be diagnosing or treating other people, and also be really careful about trying to diagnose yourself. If you think you have issues, please see some of the resources that are on our website. So, what is anxiety? This is what we did last time. Important things to note is that it has to occur frequently, cause distress, and impair your daily functioning as well. So it could be work, study, or your social life. So, there are more types of anxiety, but these are the ones that we're going to be looking at. So general symptoms for all those different types of anxiety is that heightened anxiety response. So it could be to a social situation, it could be to a particular phobia, it could be generalized, but that anxiety response is what they all have in common. They have to impair your functioning in work, study, social life, etc. So some of the common symptoms are all related to that fight or flight reaction that we've done in our previous topic when we talked about stress. So that's what's really common. Some of the physical symptoms that you experience, it could be a panic attack, could be hot and cold flushes, that increased heart rate and respiration, could be to do with muscle tension, restlessness, quick breathing, clammy hands, all that kind of thing. Psychological symptoms of anxiety, generally speaking, are things like excessive fear and worry. Note there that it's excessive. Something called catastrophizing, which is imagining the worst possible outcome of something, and also obsessive thinking. When we talk about behaviours of people who have anxiety, they're not always obvious, but it could be an avoidance of situations that cause anxiety, which makes sense. No one wants to experience those symptoms, so it makes sense to try and avoid situations that would bring up that experience. Okay. Now, if we look at general treatments, the most successful one and probably the most common treatment is cognitive behaviour therapy. So it combines both cognitive and behavioural components. So the cognitive component is about challenging and changing unhelpful thinking patterns. So if you've got someone who feels extremely anxious in a social situation, maybe at a party, it might be because they're worried they have no friends and no one likes them. So the psychologist in CBT would be trying to unpack that thinking pattern that they're unlovable or not worthy of friends. The behavioural component of that same person, that same anxiety, it might be trying to teach them some social skills or conversational skills that will help them in that social situation. So you can imagine by tackling the two at the same time, you're hopefully really treating that anxiety more generally. Okay, so CBT is your general go-to. There are also prescribed medications, but generally they're not prescribed by themselves. They're usually in tandem with some kind of therapy. And the ones for anxiety, they are benzodiazepines. They're a relaxant, and you can imagine they would temporarily relieve some of those symptoms, but they're not for long-term use because they can be quite addictive. Now, just to go through cognitive behaviour therapy in more detail, this is something that you'll need to know, particularly for the exam, something that pops up every now and then. This really aims to help a person identify, challenge, and change their unhelpful thinking patterns. For example, that catastrophizing like we spoke about, and then also learn practical strategies. So if you ever get stuck, just break down the word in terms of cognitions and behaviours. Okay. Now, step one in cognitive behaviour therapy involves really teaching and educating the person about anxiety, really trying to help them understand their condition. Step two is about trying to change and challenge those unhelpful thoughts. So it's their anxiety-inducing thoughts, and also really looking at those thoughts and thinking about how useful are they? Are they catastrophized thoughts? Really unpacking them in a critical way. Step three is dealing with avoidance. So looking at our behaviours and what situations are being avoided because of the anxiety, and trying to expose people to those situations in a safe way. Step 4 is about dealing with the immediate symptoms. So if the anxiety reaction is provoked, what what are some strategies that you can use to try and relieve that? Usually involves things like relaxation training. It could be some mindfulness. It could be some thinking strategies as well, thinking about something else. Just some strategies to deal with those situations if they come up with symptoms. Okay, so specific phobias is under the umbrella of an anxiety disorder. So more than 1 in 10 people will suffer this at some point in their lives, which is quite a large number. Slightly more common in women, which is also true for most anxiety disorders. An example of this would be an acute fear of an aeroplane. When we say we're afraid of spiders, it's not the same as a phobia. So again, thinking about our definition of a disorder, those characteristics it has to have, not the same thing. Okay, and the anxiety is extremely out of proportion to the threat of the feared stimulus. So we know that planes very, very, very rarely crash. So to have an anxiety that's so acute that you can't fly, that is really out of proportion to the threat that the aeroplane actually poses. Treatments for specific phobias, they are CBT, but we can also use systematic desensitization, which you'll remember from our learning topic. So if you need a recap of that one, please go back to our videos from that topic. But again, we're looking at conditioned relaxation, sometimes called exposure therapy as well. You can also prescribe medication, but again, only a band-aid for the symptoms. Okay, so that's specific phobias in terms of anxiety. Another one is social anxiety disorder, also called social phobia, so a fear of social situations. Now, we've got to think here, we have, particularly in Western cultures, a big push towards extroversion. We're really encouraged to be extroverted, but a lot of people aren't. A lot of people are quite shy. But there is a really big difference between being shy, which is here, and having social anxiety disorder. So again, really thinking about the defining characteristics of a disorder. Examples could include things like having an acute fear of eating in public, giving speeches, going to parties, going to particular social events, being in a classroom with other people, etc. Some of the symptoms for this are sweating, trembling, blushing or stammering in a social situation, having stomach upsets, etc. And again, the treatments are CBT and prescribed medications. Okay. Now, Beyond Blue has some great resources for this, and I have the link just down the bottom. Okay, next one is panic disorder. When you think of this one, I want you to think about panic attacks. They are one of the defining characteristics of this particular type of anxiety disorder. Now, these are unexpected and extreme anxiety. Okay, so often if people have a panic attack, it's so terrible, it's such a horrible experience that people then fear having another one. And that kind of feeds the anxiety, which makes everything much worse. Okay, so they then start to avoid situations that will cause the panic attack. Now, these panic attacks can last up to 10 minutes, and they are often associated with a heart attack. When people have them, they're often so bad, they think they're dying or having a heart attack. Okay, they get heart palpitations, they sweat, they often have a feeling of being very outside of themselves, feeling very detached. Fear of dying, trembling, shaking, shortness of breath. Often people feel like they can't breathe. They often feel like they're choking or they're going to be sick, and they get chest pain as well. So I'm sure you can start to find some similarities with a heart attack there as well. Now, treatment. Again, treatment is about cognitive behaviour therapy and prescribed medication. Medication is probably the most common for panic disorder here because you want to try and address those quite severe symptoms while also trying to address the anxiety with CBT. Okay, so again, really making sure that you keep this in mind in terms of determining whether it's shyness or a panic disorder. Now, this one here, generalized anxiety disorder, is the most common, and it affects up to 12% of the population, again, more common in women. So this is persistent and excessive worrying, but it's about everyday things. It's not just about social things or a phobia, it's about everyday things. And it really impacts people's ability to carry out their daily activities, work, study, relationships, etc. Okay. Now, it can occur with other anxiety disorders. can also occur with substance abuse, and it can be trickier to diagnose than something like a panic disorder because the symptoms aren't always as dramatic. Okay? Again, Beyond Blue has amazing resources on this, so go check those out if you want more information. This is a really handy image that someone has put together based on the DSM-5. So pause here for more information. It's quite a handy image. And again, the symptoms here are very similar to the general anxiety symptoms. So we've got restless, or edginess, sweating, you can have fatigue, you might have disturbed sleep, nausea, concentration, the cold, clammy hands, irritability, difficulty swallowing, muscle tension, and gastrointestinal discomfort. Okay, so again, we're drawing some similarities with the fight or flight reaction. And that's really what makes anxiety so exhausting, is that if you think of a fight or flight reaction happening if you were to see a bear in front of you and your body really activates for that fighting or flying away, running away, people with anxiety have that a lot. They have that reaction, all of these symptoms, they happen often, which is why it becomes so paralyzing in terms of being able to take part in daily activities. So, treatment for generalized anxiety disorder could be cognitive therapy by itself, so just tackling those unhelpful thoughts, but more traditionally and most effectively is cognitive behavior therapy, which we've already mentioned. Okay, now again, prescribed medications, but remember that they're only really addressing the symptoms, so it's a bit of a band-aid effect for that one. Okay, and again, I have the resource down here for that one. So a past exam question to do with anxiety, this also links in with the 4 levels. So the 4 levels video will be coming up soon. So if you don't quite get this question, it's okay, you can come back to it. But we have some emergency personnel, this is from the exam last year, and it's asking you from a basic processes level of explanation, explain how this could occur. So remember, basic processes are to do with cognitions, so thoughts, memory, and also learning. So try and have a go at that one, see how you go. The second part of this is explain how CBT could be used to help this person overcome their anxiety disorder. That one's worth 4. So have a go with that one. This is another one. State 2 symptoms at a biological level that could indicate that someone's experiencing an anxiety disorder. So think of some of those symptoms at a biological level and jot those down. And I'm looking forward to unpacking this in class with you all. Bye.